I want to talk a little bit about what the governor mentioned earlier in the week, that Dr. Angel walked us through early in the week as well, and that just a few minutes ago, the governor said a little bit more specifically about, which is this concept of regional variance. As we have been reporting out statewide data, we know that COVID-19 has impacted different communities and different counties across the state in very different ways. There have been some counties with few cases and no deaths for many, many days, and that has contributed to the excellent data that we've seen across the state. And we know that some counties can move safely further into stage 2, as they can attest to a number of the things that I will walk you through in a moment that they're able to achieve. And these are all based on California Department of Public Health criteria. So in order to achieve or attest to the regional variance criteria, we need the public health officer, and let me just take a moment and thank the public health officers across the state for the tremendous work, not just locally, but statewide, coming together, having very challenging conversations, thinking through some very hard decisions, and keeping Californians safe using data and health throughout the many weeks. And the work continues as we consider this regional variance criteria. Things like counties being able to attest that they've had no more than one case per 10,000 people in the last 14 days, no COVID-related deaths in the last 14 days, that they're able to protect our essential workers. Those are our grocery store workers, our transit workers, with protective gear, and that they're able to support those same workers when they're sick or exposed to COVID-19. That we have adequate testing capacity in those counties, a minimum of 1.5 tests per 1,000 residents, that we're able to do that contact tracing with those disease detectives that the governor's been talking to us about, with at least 15 contact tracers per 100,000 residents, and that furthermore, we're able to support with temporary housing a good number of those residents in our counties that are experiencing homelessness and may become COVID-19 positive. We also, as the governor mentioned, we depend on our partnership with our hospital systems in our counties. We want to make sure that each county is able to work with their hospital systems and have at least 35% capacity for surge. We talked about early on that we look to add 50,000 beds across the state for potential COVID-19 surge. This, when you break it down at the county level, at the hospitals, it is a minimum of 35% in each of those counties' hospital systems to be able to potentially handle surge in COVID-19 cases. Furthermore, that these hospitals have a robust plan to protect their hospital workforce with the PPE and other policies and procedures that keep them safe. We've talked about vulnerable populations since the beginning. We know that many of our skilled nursing facilities and other congregate care facilities must have PPE, and in order to attest for the regional variance, a public health officer must be able to say that their skilled nursing facilities have more than 14 days supply of PPE, as well as an ability to order additional PPE from suppliers when that 14 days is running low. And also, as the governor mentioned, we need to make sure that each county has the ability to understand their data and pull back from some of these modifications, slow down in some cases, reinstitute those modifications again in other cases based on their data and their own county-wide situation. We look forward, the Department of Public Health, California Department of Public Health will post these guidelines to a test for regional variance on the CDPH website. We are also building a team at the state to provide technical assistance to the counties, to review their attestations, to ensure that all of these different criteria are met, and those will all be publicly posted for you and your communities and counties to understand what your county is doing to ensure that they make your communities as safe as possible as we look to reopen certain parts of our communities and our businesses in the days and weeks to come.